Hello, my name is Brittany Church, and I'll be talking about the effects smoking has on our respiratory system. The respiratory system involves our breathing, so it is very important for it to function properly, as our respiratory system is also responsible for the exchange of oxygen and carbon dioxide. It detects odors, produces sounds, along with the air passageway for external environment to the alveoli of the lungs. We have two respiratory tracts, the upper and the lower. The upper respiratory tract consists of the nose, the nasal cavity, and the pharynx, while the lower respiratory tract is the larynx, the trachea, the bronchi, the bronchioles, the alveolar ducts, and the alveoli. When you smoke, you are inhaling over 200 chemicals into your respiratory system, and 70 of these chemicals are known carcinogen, which means they can be cancer causing. Smoking is directly responsible for almost 90% of lung cancer and COPD deaths in the United States. Other risks you may experience is heart disease, stroke, oral cancer, chronic bronchitis, emphysema, a respiratory infection, asthma, just to name a few. Now that you know a little bit about the respiratory system and the smoke you are inhaling, we're going to talk about the effects it has. The effects in the upper respiratory tract involve hoarseness in your voice as well as coughing and wheezing. This is because that cigarette smoke and the chemicals involved in it irritates the tissues and mucous membranes surrounding the mouth. In the lower respiratory tract, the chemicals go into the bronchi and blacken the airway walls, which causes the damage of the cilia, clogging the airways as the cilia is no longer able to sweep the debris. Smoking affects the lungs themselves as well by breaking down the alveoli, losing the ability to exchange oxygen and carbon dioxide, trapping both of them into the lungs. Once that alveoli has been broken down, they can no longer restore themselves. If smoking is stopped soon enough, the damage can stand still. However, there is a point that the damage will continue even if you quit smoking. Some causes of this damage is shortness of breath and difficulty exhaling. It's usually associated with emphysema or COPD. Not only does smoking affect the respiratory tract, it also affects the rest of the body. It can cause atherosclerosis, which is narrowing of the blood vessels. This is going to cause less blood flow, making it difficult to deliver the nutrients and oxygen our body needs to the correct tissues. These are my resources. Thank you guys for listening. Hope you have a wonderful night.